Hi, good evening. Welcome to yet another session. Last week we discussed about cough, and this week we are going to discuss about breathing issues. But this is a very interesting topic because it's a continuation of the last week. As we go through the slides, you'll understand why I'm telling that. Okay, so these sessions happen every Tuesday at 9 p.m. IST, and you can ask me questions, and we'll have a discussion. Okay, so breathing issues is what we are going to discuss today, and breathing issues is in Ayurveda it is called Shwasa Roga. Okay, so last time it was Kasa Roga, that is cough, and now it is Shwasa Roga. Okay, so let us slowly try getting it, understand what the Shwasa Roga is, because see, a lot of people have got these issues like cough and breathing issues, especially in places which are extremely urbanized. Here, close by, the city of Bangalore is so polluted that you have got a lot of people who have got allergic issues. It could be pollen, it could be dust, it could be smoke. That actually leads to their breathing issues, and we'll try to understand how Ayurveda looks at breathing issues. Okay, so let's start. So understanding Shwasa. Shwasa is, see, breathing is basically called Shwasa. And in the physiology, when you talk, we call that, normally it's called Shwasa, and when it becomes a Roga, we call it Shwasa Roga. But when the diseases are being discussed, you will not see the word Shwasa Roga, you'll just see Shwasa, but you have to understand that it is a diseased condition. So when there is a difficulty in breathing, it is called Shwasa Roga. The Shwasa can manifest as a disease itself as such, or it can also manifest as an upadrava or a sub issue of something else. Like, for example, if you have got a heart issue, sometimes the blood supply or the oxygen supply is not that proper, and the person can have breathing issues. So instead of what do you call a pulmonary asthma, we call it a cardiac asthma. Okay, so and if the person's got kidney issues and there's a lot of water accumulation in the body, then also he'll have difficulty in breathing. So the Shwasa Roga can actually be a single disease because it's only because of the issues of breathing, and it can also be a side symptom of other diseases also. That's what I'm trying to tell you. Okay, so the classification. Shwasa Roga, according to Ayurveda, has been classified as 5: Kshudra, Tamaga, Chinna, Mahat, and Urdhva. I'll try to talk to you in short about these things. Kshudra is a small thing. Kshudra means actually non-significant. Okay, so it's just a temporary phase. So when you exert too much, you feel that difficulty in breathing, and that by rest or by warm food or all this will automatically subside. Okay, and Tamaka is something which is a standalone disease. We call that we can call that as asthma. And Chinna is broken things, where sometimes you'll have issues and sometimes you don't have issues. Mahan is really, a difficulty in breathing, and Urdhva is upward. So the person, when it takes the breathe inwards, he takes more, and while he leaves outside, he leaves out less. So these are different kinds of Shwasa, depending upon the way the person is breathing. But by and large, standalone, Tamaka Shwasa is the most significant thing, where we can compare it to the modern day asthma disease which we see, where people have got this breathing issue. Okay, so most common reasons for Shwasa. So that's why I said this is the relationship with the Kasa or cough. So Kasa Vrudhya Bhavet Shwasa is the way this chapter actually starts, in the sense, if the cough has not been properly treated, or cough continues for a longer time, the person keeps on coughing, the lungs become weak, the whole system goes upset, and that can lead to breathing issues. So kasa vruddhya bhavet shwasa. That's the reason why I said it's directly. So after kasa, normally shwasa description comes. So kasa roga not treated properly will lead to shwasa roga. Okay, and the common reasons is smoke, dust, exercise in excess, dry foods in excess, and suppressing cough or sneeze, or even sometimes what you do is when you exert yourself a little bit too much and you pant, but you actually act normal as if you don't have that panting to impress somebody. That is very bad, and it will lead, if that becomes a habit, it will lead to Shwasa Roga. So that's why in extremely populated cities, urbanized cities like Bangalore, Hyderabad, and all, you have got a lot of dust, smoke, and even Delhi. All these cities, you have got a chance of having breathing issues. Okay, so symptoms. All of us know the early symptoms. Normally what happens is you'll get slight pain in the chest region, also on the side, I mean the flanks. You'll get a little bit of pain and discomfort. The upper abdomen feels full, not the lower abdomen. Upper abdomen feels full, and you'll feel the vayu, it pushing upwards, and you'll find it difficult to breathe. Okay, the temples, you slowly start getting pulsating pain in the temples. It need not be severe, but mild thing. So that this can lead to breathing issues. Okay, so apart from that, the pathogenesis, how it happens, pranavayu normally, it should move upwards and downwards, but it so happens that there is a block with a lot of phlegm and other things, kapha, and it starts pushing too much in the opposite direction, and the person finds it difficult to breathe because there is a blockage in the air passage. Okay, the trachea. So the person finds it difficult to breathe, and that is the reason why you get a breathing issue. And how do you manage this? Okay, so management is an important step. So when there is too much of phlegm, and that is the reason why this obstruction is happening, removing of the phlegm is very important. That should be the first thing. Remove all the phlegm. Once the phlegm is removed, then it becomes only vata, and then pacifying the vata has to be done. So these are the two major steps we do to manage what you call Shwasa Roga. Okay, a little bit going in detail. What? Kshudra, as I said initially, Kshudra is a temporary thing. It goes down by itself. And Chinna, Urdhva, and Mahan are not easily curable. But if a person has got a lot of complications, then it's difficult. Otherwise, it is manageable. Tamaka Shwasa is always difficult. Tamaka Shwasa or asthma is not something which is very, very easy to cure. But still, yes, we cure it really well. There are very good treatments. If you do it the right way, yes, we can cure what you call asthma. Okay, and here Pathya is very important. Pathya is restrictions or what you follow. It could be your food or your lifestyle. If that is proper, Shwasa Roga can be managed to a very, very, very large extent. Okay, so you can start asking me questions. It's not a problem. Okay, I see always Ganas always start asking questions. Okay, so Shodhana is basically cleansing here. So Vamana is very important. You can make the person vomit. In children, especially when they have got breathing issues, you'll notice that there is a lot of phlegm. So once that phlegm is removed, 50 or more 70% of the issue is gone, and the person feels much better to breathe. And then Virechana, because the vata has to come up, vata has to go down. Because the vata is coming up, you have to push the vata down. So in Tamaka Shwasa or in asthma, the Shodhana therapy that has to be used is Virechana or Purgation. Okay, Tamakastu Virechanam has been mentioned very clearly. And if you'll notice that most people who have got chronic breathing issues will also have difficulty in passing motions. And once that is managed really well, you'll find a lot of relief in his breathing issues. Okay, And Shamana is again pacifying the thing. So once the phlegm has been removed and it is only Vata after point of time, then you should do uh, procedures to control the Vata. That is basically called Shamana or pacifying. Okay, so this is a very important condition which people suffer a lot because of this. If taken care of really well and early intervention happens, this is really curable. Okay, so these sessions happen, as I said, these sessions happen at 9 p.m. every Tuesday, and you can ask your questions. Okay, now let me start the questions. I can take questions. I see the first questions from Ghana. How to protect ourselves by respiratory issues during rainy seasons? Uh, Normally, when there are different kinds of breathing issues, we notice that sometimes when humidity is high, so when you have got breathing issues which is caused because of excess of phlegm, for those people when humidity is high, you will see that their breathing issue goes up. And for people who get breathing issues when it is extremely dry, for them the breathing issue is slightly better during the rainy season. Okay, so it depends from person to person. So respiratory issues, actually, I have noticed that respiratory issues are high, not when it is during the rainy season, but when it is extremely cold, yes. But otherwise, when you have got the flowering season, the spring, when you have got a lot of pollen, and when the city or the place where you're living is extremely dry, you have got a lot of dust and pollen flying around. That is where you have got a chance of getting breathing issues. But respiratory issues, yes. If it rains too much and you have a lot of humidity, you have a lot of phlegm, and when there is phlegm, there is always a chance of you catching infections. And in rainy seasons, we notice, especially in Kerala, that there are a lot of mold, okay, fungus everywhere, and that is one other reason why people get respiratory infections. And phlegm is a little bit more during the rainy season, and when the person coughs, phlegm comes out. So that is one other reason why cough or respiratory infections actually spread faster during rainy seasons. Okay. Yes, Amrit, Ramesh, that's what I just mentioned to you, right? When the motions are blocked, see, Vayu has supposed to go out. It's very simple for us. The Vayu keeps on going up and down. Vayu has to go down. The moment the Vayu stops going down, and then it has to come out, it starts coming up. And that is when you get breathing issues. So you have to see that your bowel movements are perfect. That's why I said, Tamakas to Virajinam. In Tamakas Shwasa or breathing issues, the line of treatment is seeing that the person passes motions really well. Laxatives work really well. And there is one specific medicine in Ayurveda called Agastya Haritaki or Agastya Rasayanam, where it is mainly Haritaki, which is a laxative, and that is supposed to be consumed when you have got breathing issues. Okay, so see that your motions are clear. That's the reason why you're supposed to go up, go down is coming up. That's why you're getting breathing issues. Okay, what all breathing exercises we have to do? See, breathing exercise, sometimes people don't understand that it is very important to increase the capacity of your breathing. We don't breathe consciously, we just breathe very, very short breaths. That those don't help at all. You have to actually take time, be mindful when you're breathing. Take a long breath and see that you fill your lungs, because lungs are just like balloons. The more and more you stretch and fill it, the more and more effective it becomes. And the more you stretch it, there are small capillaries there which actually say they've got a lot of blood supply around the lungs. And why do you have that blood supply? Because that blood, the oxygen which comes into the lungs, have to get absorbed into the bloodstream. So if your lung is expanded, that means diffusion happens better. So rather than just breathing, any breathing exercise which you can take is fine, but see that you actually fill your lungs a little bit more and stretch your chest and see that you fill it. Holding it for some time is actually very good, so that effectiveness of your what do you call lungs go up and oxygen supply exchange, it happens better. See, yeah, Marcia, yes, lung fibrosis. It is a condition where a part of the lung actually becomes hard, like, and the small alveoli, the small cells through which diffusion happens, it solidifies, and you don't have that what do you call air transfer happening, oxygen, carbon dioxide. It is very difficult, I understand that. So what happens, the lungs capacity itself goes down, and it is something, sometimes it can spread. So if you have got lung fibrosis, just check it out with your pulmonologist, and if it is spreading, it is always best to remove that lobe of that lung, because you have got multiple lobes in your lungs, and if you remove one lobe also, you might have a little bit of issues, but it is not very dangerous thing. So if you've got fibrosis spreading, it's always good that you remove that portion. Okay. I've noticed that my ears get wet during nighttime and itchy too. See, if you look at when we talk about Vata Pitta Kapha, okay, this is how people understand. When there is pain, there is Vata. When there is burning sensation or heat, there is Pitta. And when there is itching or heaviness, there is Kapha. Okay, so when you are congested, okay, Harsha, I would say you might be congested, you might have a blocked nose, your sinuses might be full, your ears. So that is the time where your ears, eyes, nose, all those things start itching. Okay, so kapha is slightly on the higher side. I would say that it's always good for you to do a decent steam inhalation. And if you have got somebody who can do nasya or pouring nasal drops inside your eyes, inside your nose, so that a lot of phlegm comes out, you have to get that phlegm out. See that you don't consume too much of cold or heavy foods which increase, and sweet foods which increase kapha, and also focus on doing a little bit of physical activity so that the kapha goes down. Okay, so any other question? So breathing issue is, it is very common, especially in children. So when kids come to us with breathing issues, we notice that as per age, the first stage of a person age is kapha, second is pitta, and last is vata. That's the reason why, as you age vata, we say vata is air and space. You person shrinks and you start getting all those pains and all those things. In the middle age is kapha, pitta, and that's where you see a person is very fiery, go-getting, and all those things. The first stage of the life is kapha, predominantly kapha. So especially for children, kids, small babies, they get cough, they get running nose, they get breathing issues. Everything related to kapha comes to them. So I would say, how do we manage this? Is what I tell parents to do is when the kid has a tendency to vomit, okay, it's actually good. Okay, the kid drinks milk, and when the kid pukes, a lot of phlegm goes out and the child feels extremely relaxed. But there are some kids who resist or who don't vomit at all. So it's not that easy. So what we tell parents to do is apply a little bit of heat on the chest initially. Okay, don't directly apply. For a small kid, you can heat the towel and give a little bit of heat on the chest so that the phlegm in the chest melts a little bit, and then you give a lot of milk, normal milk. As per daily routine, the child drinks milk, right? So you make the child drink milk, and after that you put your finger inside the mouth and see that the child vomits. Okay, and the moment the child vomits, lot of phlegm goes out, and once that phlegm goes out, the remaining phlegm the body will be able to manage. Okay, breathing issues and cough and all those things will automatically subside. How much ever what do you call, cough syrups and all those things you give, it's very difficult to remove the phlegm like the way you remove it by vomiting. I hope you're able to understand that. So it's always good to see that the child vomits if he's got cough. I can't do long, deep breaths during my meditation. Also, I can't hold breath for more than 3 counts. Yeah, it's again a practice, Mona. I would say slowly start doing it and see why is your left nostril not breathing out. If you have got some structural issue, it could be a polyp, or it could be your nasal septum is extremely deviated. There might be some block, or your sinuses. There might be something coming from your sinus and blocking it. That has to be taken care of. And see why you are not. So I don't know why you are not able to hold your breath for long. I think that by practice you'll be able to do it. And normally when you are stressed, also in an office, you become stressed, and you can feel the palpitation happening, and your breathing rate going up. You can do something. You can get up. You can put your arms onto the sky, stretch yourself up, put your hands to the side, stretch yourself. Try giving a little bit of space to that lungs here, so that what happens is, and take 2 or 3 deep breath and holding your chest up, so you are actually giving a lot of place for this lungs to expand. And then when that happens, oxygen supply to the blood and the carbon dioxide excretion from the blood happens much better. As I just told before, you will feel much better. So the moment you are tensed, I would say you go out for a walk, take a short walk, because blood supply has to reach your heart. And when you walk, as your calf muscles, they pump the blood up. They're called the pseudo hearts, the second heart. They pump up. Yeah, they pump the blood upwards into the heart and into the brain. And when you do this reaching, which we call reaching for the sky, and stretch yourself and breathe really well, you will feel much suddenly you'll feel you're relaxed. Okay. Ghana. Is it okay to take oil bath, head bath when we have cold? Technically speaking, it is not good to take a head bath, applying oil and taking a head bath when you have got cold, because cold is something when you have got too much of kapha, you apply oil, that again increases the kapha a little bit. And when you take a head bath, even if it is warm water, okay, hot water is extremely contraindicated. Even if it is warm water, after a point of time, you'll notice that your head suddenly cools down and the chance of your kapha going up is more. But okay, there are conditions where I tell patients to take bath when they have got a cold, when the nose is extremely stuffed and it refuses to come out. Okay, I tell them to do things which will increase the kapha a little bit. I ask them to take food with curd, eat a little bit of sweets, take a head bath, and suddenly there's sudden increase of cough, increase of phlegm, and nose starts running. The moment the nose starts running, I'll tell them not to take a head bath. Hope you are able to understand this. I just wanted to increase that quantity so that that flow starts. Once the flow starts, we tell them, no, now don't take a head bath. Okay, then you do steam inhalation, you help it come out. Okay, Gana. There are herbal cigarettes, yes. There is something called Nirdosh, which is available in the market. Just because I said their name, I am not endorsing it. Okay, anything you burn, even though, yes, we do dhupana treatment. Once you do the vomiting or you do nasya, we do that dhupana or the smoking to remove the little bit of balance kapha. That's actually fine. You can use it as treatment, but to use something like a cigarette, which you use, it could be cinnamon or it could be anything on a regular basis, I would say is not good. Any smoke you are exposed to for a longer period of time is bad. That also includes agarbatti. Okay, agarbatti is a killer. If you have got the habit, and agarbatti, agar is actually the name of, there is a tree, a plant called agar. okay, which the sticks actually burn. You cut into small pieces and burn it, it actually burns. Now people don't use agar wood at all, even though it's called agarbatti. And in Malayalam we call it chandana tiri, where we use a stick and we apply chandana paste on it and burn it. Now nobody uses chandan. Okay, everything is chemical, and that smoke is a killer. So if you've got the habit of lighting an agarbatti, I would say don't do it. Or if you want to do it, don't do it in closed rooms. Let the smoke, just don't go and sit beside the agarbatti. You know, you're lighting an agarbatti and sitting beside it and doing meditation and breathing in the agarbatti smoke. Big no. Okay, so Aditya, to come into your point, I would not recommend it for a long term. Yeah. So snoring in children, Pushkal, if you notice, your question, if you notice that child who is snoring, two things. One, the child is an obese child. First thing. Second thing, the child has got congestion. So both things, normally in kids, snoring happens because there is a lot of kapha. You have to do everything to reduce the kapha. See what the child eats. Okay, cheese, mayonnaise, paneer, curd, too much of things. You have to cut down all those things and see that the child is physically active and loses a little bit of kapha by doing physical activity. Okay, and yes, that's one reason why if the nose is blocked, people start breathing through the mouth. So that is something that it could be an anatomical problem. It could be because, as I said before, it could be a polyp or nasal septum bend or something, or injury, or too much of sinuses, too much of block. All those things, pathological conditions, have to be managed. Sometimes what happens is even the position of the head, if the position of the head goes like that, automatically the mouth will open and they start breathing through the mouth. See that the head position is also slightly bending so that the mouth closes. How much? See, there is no limit to snigdha bhojan. How much can we? It's a good question. It again depends upon your digestive capacity, or two things: your digestive capacity. Second thing is that what kind of work you do. Okay, and if you're somebody who is sedentary, then the amount of snigdha food you eat should be less. Snigdha food is oily food. Okay, it should be less. But if you are somebody who is going out and doing a lot of physical labor, then definitely you should have more of snigdha food. So and that depends upon season. Okay, if it is the cold season, you don't have to take too much of snigdha, but if it is a dry season, yes, you have to take more snigdha food. So it depends upon a lot of factors. But either way, Anirudh, don't overdo it or don't underdo it. Try to hit the middle path. Okay. Advisable to oil the nose to treat. Oil the nose, yes, we normally do nasya. See, nasya, we have got something called Brahmana nasya, which actually promotes oiliness. So that is very much advisable, Masya, to do when the person has got dry cough. Okay, when it's got wet cough, then also we can do nasya, but that pouring oil inside the nose will not be to nourish, that will be to dry it. So you can do it. The oil changes. Okay, dry cough should also be managed. There are different kinds of treatments, and I can tell you an incident which happened to me when I was in my college. I traveled a lot. It was winter. I was traveling in a bus at the side seat. The window was broken, so I was exposed to a lot of cold air. And when I reached my college, I was coughing. A little bit of phlegm was there. After the phlegm went, I was coughing. It was completely dry cough. So I was in my second year. So I immediately asked my professor, what am I supposed to do? He told me one superb thing, to do. Even though I don't consume eggs, so as medicine, I did that. He told me to break an egg fresh, not boiled. Put it inside a glass, pour a little of pepper, and have it as such. 3 days I took. What happened is the moment that egg started going inside, within 3 days, my dry cough, which came due to exposure to cold wind, subsided. So as I said, giving a little bit of oil is very good to subside dry cough. Yes, Mona. That is how menopause happens. Menopause. See, we don't call it menostop, right? The word calls pause. So you give a pause, it again plays. You give a pause, it again plays. It gives a pause. But what happens is over a period of time, you see that the gap between two periods will go down, the flow will go down, and that is why menopause is something which is a natural thing that happens. See, like, anything that is born has to die. If there is a beginning, there is an end. Anything you can take, okay, in this world, if something has, so likewise, your periods, it was born when you were 12 or 13 or maybe 9, 10. The moment it starts, it has to die. So that death happens close to what? So there is a shloka which says, one liner, Varshat Dwadashat Urdhvam Yati Panchashata Kshayam. Varshat, from the age, Dwadash, from the age of 12. Varshat Dwadashat Urdhvam. So above the age of 12, it starts. Okay. Yati means it repeats. Panchat Shatakshayam. At the age of 50, it stops. So this happens. Okay. So the only thing is that you have to just accept it and see that you don't stress out too much. And if you have got other things, probably, you can actually consult a good doctor and the person will actually take you through the menopause. But it's nothing where you have to be over worried about. It is a natural process which your mother, your grandmother, your great grandmother, everybody went through, and all of them have been fine. Okay. Nasyam with children, I would not advise to do Nasyam with children until and unless they are 10 years of age, Pushkala, because it's not easy to do it, and they might not cooperate, and it is not very good to do. So any kid above 10 would be the best thing for you to do. Let's yoga together. Yes, nasal polyp, any growth, even in Ayurveda, if you look, surgery has been mentioned, but small nasal polyps can be removed. There is a specific oil in Ayurveda called Nasa Arsha Thailam. Okay, Nasa Arsha Thailam, when you drop it inside your nose, it will remove your nasal polyps. But if it is too big, it's always good to undergo surgery. Mosina, too much mucus in the mouth, how does it affect digestion? Is it related to kapha imbalance? So yes, okay. Too much mucus in the sense, if it is saliva, okay, or if mucus, if it is a sticky one, yes, that denotes that you do have too much of kapha. Okay, and if it is, we call that lala srava, okay, that means there is so much of slimy thing in the mouth. That is definitely because of kapha, and there is always a chance of you getting indigestion because of that kapha. Okay, so what you have to do is, see, anything that can increase kapha has to be removed. That means sweets, I would say a complete no to anything sweetened. It could be laddu, jalebi, it could be pastries, it could be kheer, anything. It could be sugar in tea or coffee. Cut down it completely. Okay, stop day sleep. Start doing regular exercises. Anything that will increase, cut down on fermented foods like idli, dosa, bread, bun, cake, biscuit, pastries. Okay, all those junk food, mayonnaise, okay, cheese, paneer, anything that can promote bulk has to be cut down. And then anything that will reduce bulk, that is physical activity. You start doing physical activities, these things will automatically come down. Okay. Spirituality, see, the way you look at anything, I would say, Aditya, matters a lot. And spirituality is basically realizing that there are nothing to in this world. That is the highest form of spirituality. So if I would say, you have got an issue, and spirituality always believes that nothing is permanent. Okay, so if you have got a disease today, you'll know that tomorrow you will not have a disease. And if you don't have a disease today, that doesn't mean that you will not have a disease tomorrow. So being spiritually connected somewhere is very, very important to become, to actually grow in life. And there are two things, spirituality and religion. There are two different things. In religion, what you do is you seek something outside. In the sense, you go to temples, you read your holy books and all those things, and you try to basically be religious. Different. So you travel, to be religious. But when you're spiritual, you stop all those things, and the only travel what happens is inwards. And the day you realize that you are part of nature, and nature's natural tendency is to keep you healthy. Okay, and this body also is from nature, and the body's natural tendency also to keep itself healthy. Only we interfere in a lot of things to throw it off track. So spirituality actually helps you to realize that we are the people who actually cause this misery for us. Okay. Yeah, Rahul. Sound from stomach. Pet se gud gud ki awaaz aana. That is basically see, a little bit of sound is normal, little bit of gas is normal, because any metabolism that happens, there will be gas being released, and if it is within normal limits, it is fine. You'll feel like burping, you'll feel like passing gas. That is normal. But if it is too much, and in Ayurveda that word is called atopa. Okay, if there is too much of atopa, that means there's too much of vata in your system. Okay, your body, your gut, and all those things are too dry. So to manage that, I would say, consuming anything oily, not fried. So probably ghee in decent quantity, applying oil on your body and taking a shower, warm water. Okay, having food on time, food again which is slightly oily and warm. Okay, and never ever staying awake beyond 9:30, 10. Sleep really early. Okay, if you do all these things, most of your the atopa issues will subside. Okay, nothing to worry too much. Any other question, or have we come to the end? Can I take bath after finishing pranayama? Samriddhi, I would say, it is always good for you to take a shower and then sit for pranayama. Two reasons. One major reason is, you want the mind to be calm. And if your mind has to be calm, your body has to be calm and still. And if you have taken a shower, you have worn clean clothes, your body is actually better. Your body feels better, and you are in a better state to keep your body steady and calm. Okay, so I recommend that you take a good shower, clean yourself, wear clean clothes, and then sit for pranayama. Can you take a shower after pranayama? Yes, but I would say not immediately, because pranayama actually generates a little bit of heat in the system. Wait for at least an hour or so before you can take a shower. But after shower, you can immediately sit for pranayama, no problem. Okay, Prasad, you have got gastric reflux. Look at the lifestyle first. What is going wrong? And it doesn't just start like that. Stress is one thing which can add a lot to your GERD issues. Okay, so stress is one thing. Second thing is the kind of food you eat might be spicy, sour food, and your sleep timings, your wake timings, your lack of exercise. All these things actually lead to GERD. Okay, now according to Ayurveda, okay, we say nidana parivardhanam chikitsa. Just taking medicine will not help you. If suppose you say, okay, you're taking a pantoprazole, or you are taking Bhaskar Lavana. As far as Ayurveda goes, if you take Bhaskar Lavana, you'll feel much better. So I would say taking Pan or Bhaskar doesn't make a huge difference to me, because both are medicines. Both are different kinds of medicines. That's all. I would say removal of the causative factor. What actually caused this GERD to you is one thing you have to understand. Why are you getting this acid reflux? It's something we have to realize. Try to work on that. Otherwise, you keep on taking any medicine, the symptoms will get subsided for the time being, but the disease will still progress from the, your highway. You have tried to block the highway, but the disease is still progressing from the service lane. Hope you're able to understand that. So trying to understand what the causative factor is, and stopping the causative factor is half the treatment. After that, we can manage it. And otherwise, you will never get a permanent solution. Prasad. Okay. And it is something which we can really work well and manage in Ayurveda. I'm telling you, we can cure this thing, but provided you understand what you understand what is going wrong with you, why it's coming, and then work on that. Okay. So great. Thanks a lot. I think we have come to the end of a session today. I will see you next week, same time at 9 p.m. Okay. Bye-bye. Good night.